Well, tonight, medical professionals on both sides of the bi-state are now issuing a warning about the potential impacts of what they're calling a quademic. 5 on your side's Holden Kerwicki spent the day speaking with doctors from multiple agencies. And Holden, what are they concerned about here?
Well, Brent, typically COVID, norovirus, RSV, and the flu really kind of have their own season. But this year, people are getting these viruses roughly at about the same time, and there's concern it could overcrowd hospitals. Every year as the calendar flips, doctors at BJC, SSM, and across Illinois start seeing an uptick in sick people.
We go through the holidays, people have a chance to move flu around and other colds and viruses like that as people travel and see each other. And as we get into the new year, we start seeing this sort of surge in transmission.
So we're seeing a little bit of everything.
Flu,
Norovirus,
COVID,
RSV.
While COVID cases are down from year to year,
For most people, COVID is not as serious as it was in the beginning of the pandemic.
at the same time, cases of influenza A, RSV, and norovirus are on the rise.
Their immune systems don't have time to recover, so it can be more difficult to get over these illnesses when you have them back to back.
According to medical experts, the quademic is a side effect of some of the preventative measures taken during the peak of the COVID pandemic.
Previous years, because of social distancing and masking, people weren't getting really too sick and their immunity got a little bit less. So now that we're back and we're doing things together, everybody's sharing their germs.
As we return to normal, that's part of this return to normal, is building up immunity to things like pertussis and whooping cough.
The good news is there are safe ways to protect yourself beyond washing your hands and covering your cough.
3 of the 4 in the quademic, we do have safe and effective vaccines. I would rather get the vaccine, get the jab in the arm, than being off work.
That's why they're asking you not to come to the hospital unless absolutely necessary.
Stay home until you're feeling better. You can treat yourself with over-the-counter medications in most cases, but if you feel like you need medical attention, come in and we'll see you.
Now, if you do get sick and believe that you have one of these viruses and you feel like you do need to see a doctor, both SSM and BJC are encouraging people to first utilize virtual appointments, which are available for both existing and new patients. Brent?